warm welcome to another Top Doctors online interview with one of our leading experts. Today, we have the privilege of speaking with Dr. Sobia Ashdad, a leading consultant endocrinologist based in South London. Super, hello, thank you so much for speaking to us today, Dr. Ashdad. Would you like to introduce yourself?
Yeah, thank you very much, Lauren. I'm Dr. Sobia Ashdad. I'm an endocrinologist. I work in NHS and also do private work in BMI Sloan Hospital.
Perfect, thank you very much. So today we're going to be speaking about pre-pregnancy advice for women, specifically with chronic illnesses. So the first question I have to ask is, how can women in general prepare if they're planning for a pregnancy?
Thanks, Lauren, for asking this question. I always tell my patients that pregnancy is a journey. And just like any other journey, you need a lot of planning before starting the journey to see what resources you will require, how long the journey would be, about the stops, about the testing, and all the equipment that you need for that. Just like that journey for pregnancy, you need to have a planning. So at the end of a journey, you can have a healthy mother and a healthy baby. Especially with women who have chronic illnesses, they are on different medications, they need extra care, monitoring and testing, talking with healthcare professionals, your general practitioners, and if you have a specialist a condition, then with your specialist to be able to have the journey smooth.
Perfect, thank you so much. So do women with chronic conditions, for example, diabetes, thyroid issues, would they require extra support planning a pregnancy?
Yes, they do need extra support for pregnancy, and lots of women, when they are already engaged with their general practitioners and specialists, they do tell the patients that when you decide to start a family, you need to have a pre-pregnancy consultation so we can review and see that their tests are, their levels are in the right range that you need for conception. Especially true for diabetes and thyroid, because in diabetes, if it is poorly controlled to begin with, then a mother and a baby can have lots of complications. So they need to have a test prior to pregnancy, ensuring that their levels are adequate to start a pregnancy, and then a lot of monitoring during pregnancy. And same is good for thyroid, because especially underactive thyroid patients, they need to see their baseline blood test and need to understand that the baby's thyroid is dependent on mother's thyroxine. So the requirement will go up during pregnancy. So we have to increase the thyroxine accordingly. Here I want to say that most women, lots of women find out they are pregnant when they have missed their periods by 2 weeks. And that means that they are 4 weeks pregnant at the time. And thyroid starts to develop in first few weeks of pregnancy. It will be almost developed by 4 weeks. So if you're not aware of that and you don't increase the thyroxine according to that, then the baby's thyroid will be underdeveloped. So it's extremely important that these women understand, engage, change their medication pre-pregnancy, and have a continuous monitoring throughout pregnancy.
Perfect, that's very interesting, thank you. Is there any other conditions? We mentioned diabetes and thyroid. Obviously, they seem to be very prominent issues. Is there any other chronic illnesses that people should consider or should be aware of, I suppose?
And if you have any medical condition and you're on a treatment, then you need to engage, because there are lots of medications that you cannot continue during pregnancy. And as I said, lots of women are now deciding to have a baby a bit later in age, in 45, even 50 years of age. And if they are on medications, that they need that adjustment, just like if you are hypertensive, and that means high blood pressure, and you're on a blood pressure medication, lots of blood pressure medications are not safe in pregnancy, mainly because we haven't done a research to prove that they are safe. So we cannot justify continuing that. So if you have a blood pressure problem, you need to engage with your general practitioner or your specialist and decide that when the day you will become pregnant, how you're going to change that, how you're going to change the medication to. And some of the doctors might decide to change it in the pre-pregnancy time. As I said, that lots of women don't even know that they are pregnant till 4 weeks have lapsed. So it's better to just change, modify their medication when they start to plan to conceive. If they have high cholesterol, they're on a cholesterol medication. Again, we can't justify continuing that medication. A very simple example, like a woman who are on a treatment for acne. There are lots of women who take treatment for acne and like with vitamin A derivatives like isotretinoin, that's the name of the drug, and it's completely teratogenic. And dermatologists, they only prescribe you that medication if you sign a disclaimer that you will not become pregnant, because you just cannot become pregnant on that. So I will just say default setting should be that if you have a medical condition and you are on medication, then you need to have a pre-pregnancy consultation and review of your medication.
Perfect. Thank you. Very, very insightful information. So can such conditions, any of the aforementioned conditions, can they affect any stage of pregnancy?
Yeah, absolutely. Because in every stage of pregnancy, there's a different process happening. We need to understand that there's a new human being developing, right? So at different stage of life, there's a different organs that are developing. So they have different needs. And towards the end of the pregnancy is the size of the baby that matters. And some of the drugs, and if especially like diabetes, if the diabetes is not controlled, and it has been controlled throughout the pregnancy, but towards the end of the pregnancy, if that's not controlled, it can increase the size of the baby because all the sugar will go to the baby. The baby can get really big in size, which can just affect the labor delivery of the baby as well. So and if it happens at the start of the pregnancy, where mother is not even aware that she is pregnant, then all the very important structures like your brain, your nerves, they are developing in first few weeks. And if you don't take folic acid, then I don't know if you're aware of a very landmark case that had just happened where a patient has won the case against a general practitioner who did not advise her to take folic acid, and the child was born with severe neural tube defects. So it's very important because it's the pre-pregnancy and in the first few weeks of pregnancy where you need folic acid. So at different stage, you have different requirements, different level of monitoring is required, and it's throughout the pregnancy till the baby is delivered. It needs a really, really careful treatment and monitoring.
Perfect. Super. That's super interesting. I hadn't heard about that case. Fantastic to hear, though, that there's proactive measures being taken to ensure safe pregnancies. So the next question was, is there extra monitoring or testing required, which you have mentioned already? Is there any perhaps concrete examples you would like to outline of such extra monitoring or testing?
Yeah, like just to give you an example of thyroid. Outside pregnancy, we are not that strict with thyroid levels. You might, if they're leveled, you might want to check your thyroid blood test once a year. But during pregnancy, you need to know what the levels are of thyroxine. You need to adjust the dose, and you want to check it at least once every 3 months, like every trimester. With diabetes, again, outside pregnancy, we might want to do a blood test every 3 months. It's a HbA1c, which is a blood test where you can check what the average blood sugar has been for last 3 months. But in pregnancy, the sugars go up and down so rapidly that we cannot take average as a right number because of the rapid fluctuations. So it's very high, then very low. So the average might be okay, but you can't accept that. So for diabetic patients, you need to have blood sugar testing 4 or 5 times a day. So, and then luckily, at least in UK, you now can have a patch on your arm where you just need to scan it through your mobile. You don't need to finger prick each time, and it's free, available to all pregnant women, and they can have this monitoring that way. Because you need to see what the sugars are straight after woman has eaten. So what we advise pregnant women who are known diabetic is that they will check your blood sugar first thing in the morning and then 2 hours after eating, depending on what kind of diabetes they have. So it's a lot of testing you need. And towards the end of pregnancy, in diabetic patients, you might have to scan them every other week. So very, very close monitoring is required. That is for the women who are known to have diabetes. But then there are women who don't know that they are diabetic, and they need testing and awareness if they fall in a high risk group, which means that their age is above 30, their BMI is above 30, and they're overweight, or they previously had a big baby, or there's a family history, then they need a routine testing for diabetes at 24 weeks. And if they had previously had diabetes at 16 weeks, normally if you're not pregnant and you're in your 20s and 30s, nobody is going to test you for diabetes. But if you're pregnant, and you need to actively test, because they can either have an underlying diagnosis of diabetes not known, or they can develop diabetes, what we call pregnancy diabetes, like gestational diabetes. And they also have a risk of lots of complications if you don't treat them. So yes, a lot of monitoring and testing is required.
Absolutely, but better safe than sorry, as they say, 100%.
Yeah.
Super. So we've also mentioned the continued use of medication throughout pregnancies. So can women with certain chronic conditions continue to use their medication or treatment?
No, not all medications are safe. So that's the reason you need to engage with your doctors and decide pre-pregnancy which one so you can continue. Luckily, in diabetes, insulin is safe to continue. Metformin is another drug for a diabetes that's safe to continue. But lots of other diabetic medications are not safe to continue. So we have to change that. The thyroxine, blood pressure medication, cholesterol medication, lots of other medication for other conditions, they are not safe. So you need to adjust. Sometimes we decide to continue the medication because the risk, when we weigh risk and benefit, the risk of stopping the drug is too high. So we decide, fine, we will take the risk because the benefit outweighs the risk here. But that conversation needs to happen between a patient and why we have decided to continue that, because there is a potential harm to a baby. But we can't stop it because the mother requires that, like lots of seizure medications, seizures, epilepsy, we decide to continue. But again, the dose adjustment needs to be required. Some of the conditions, I'll give you example, is a condition where prolactin is a hormone, and some women have very high prolactin levels, and that interfere with their pregnancy. If you have very high prolactin levels, milk hormone, then mother can't conceive, and they might have infertility because of that. So if they're on a treatment, we start them on a drug to lower the levels for prolactin, and it works. And we advise them that as soon as you become pregnant, you don't need to continue that, because A, it's not required, and it's also, we don't know what the effect, we haven't done enough research to see what the effect would be on a baby, but it's not required anyway. The job was to get you pregnant. If you are, you stop it, and you don't need to take it anymore.
Perfect, thank you. And we're on to our last question. What general advice would you give to women who are suffering from chronic conditions but wish to become pregnant?
I will say that we are very lucky to be in this time and age where lots of medications are available. Enough research is done to help these women. So there's lots of help out there. There are lots of medication, treatment options. So don't just be blind to the options they have. Do research, talk to their patients, especially if they have any special condition, then they need to involve with the specialist, plan, ask the right questions, that what do I need if I'm planning? Do I need to see you before becoming pregnant, starting a plan? What changes would be required? What drugs are safe? What my risks are? So they need to ask all these right questions to the doctors involved in their care. But what I will say is not just don't get a blind eye on this.
Absolutely. Perfect. And is there any advice you would give to women in general, perhaps about screening for underlying conditions?
Yes, again, the advice would be to know their risk, to have the testing, if they have a very strong family history, if they fall in a high risk group because of their body mass index, that's their weight or lifestyle, then yes, please engage. There is enough help out there. There are lots of options, treatments, and there's no reason why we can't have a healthy mother and a healthy child at the end of this journey. And it's very sad to see complications. It's a very happy time for the family. And then if you have complications that could have been avoided, it can be extremely traumatizing for the whole family. So, and if it's avoidable, then we should do everything to avoid it.
Wonderful. Dr. Shobhia Arshad, thank you so much for taking the time to speak with us today. We really, really appreciate it.
Thank you very much for your time.
No problem at all.